Osteoporosis is a condition of bone demineralization resulting in fragility and increased fracture risk. An estimated 300,000 Irish people may now have osteoporosis, and its prevalence is increasing. The number of people with osteoporosis will double in the next 20 years. It has significant health implications, with mortality rates of up to 50% in men over 60 years of age in the year following hip fracture. Alarmingly, only approximately 15% of people with osteoporosis are diagnosed. An individual's fracture risk is related to several factors, the three most significant being falls risk, bone density, and bone quality. Falls risk assessment requires a holistic approach. It involves assessing cognition, vision, balance, musculoskeletal and cardiovascular systems, as well as ensuring a safe, trip-free, well-lit home environment. Bone density is measurable using a DEXA scanner, the gold standard. Bone quality is hard to define, but it's best represented by the individual's history of fracture. Once an individual has a low trauma fracture, they're defined as osteoporotic, and their risk of further fracture doubles. The current management of osteoporosis involves patient education regarding diet, exercise, sun exposure, as well as screening for secondary causes of bone loss. DEXA scanning and the use of the FRAX fracture risk assessment tool give estimates of an individual's 10-year fracture risk. FRAX with bone mineral density predicts fracture risk better than clinical risk factors or bone mineral density alone. Though criticisms have been levelled at the FRAX web tool, it does have value in stratifying patients into low, medium and high fracture risk, allowing the clinician to target the at-risk cohort. Atypical femoral fractures are an alarming side effect of bisphosphonate and denosumab therapy. However, the risk needs to be put into context. For every 1,000 females treated with bisphosphonates for 5 years, we prevent 120 typical fractures versus the risk of causing 5 atypical femoral fractures. So the absolute risk to the individual patient is low, between 3 and 50 per 100,000 patient years. Corticosteroid use and prolonged bisphosphonate therapy put patients most at risk, particularly after 7 years of bisphosphonate therapy. As a result, the guidance is to now stop treatment between 5 and 7 years for either a drug holiday or to change to an alternative therapy like denosumab or parathyroid hormone. Thank you.